Town of North Hempstead Supervisor Judi Bosworth recently spent some time at North Shore University Hospital to honor 3 very special people, hospital volunteers who have served for more than 100 years combined. North Shore University Hospital, located in Manhasset, is part of the North Shore LIJ health system, an employer of more than 48,000 people. North Shore LIJ is an award-winning health system that includes world-class tertiary hospitals, a nationally distinguished children's hospital, a renowned psychiatric facility, and a mosaic of community hospitals and health programs. We all know that a hospital's healthcare team plays an important role in a patient's well-being. But there is another group of individuals that is also essential to the healing process. They are the hospital's indispensable volunteers. They selflessly give of their time, skills, and compassion in a variety of ways. One of these volunteers is Sylvia Lester of Great Neck. Sylvia has been a volunteer for 61 years and created the Patient Relations Department in 1976, which has now grown to over 40 volunteers.
You know, we were coming here to honor 3 very special people, and I saw Sylvia Lester and went, Sylvia Lester, a legend in her own time. So
well,
it's really...
we knew each other a little bit.
Yes,
yeah.
Absolutely.
And our husbands were sharing the same kind of life.
I remember meeting you when the Women's Auxiliary was really just starting, and you were so at the forefront of making sure that patients at North Shore were advocated for.
Before that, I was a young mother and a husband just starting practice.
Wonderful
I know.
Cancer surgeon, breast surgeon.
Yes, breast surgeon.
But this was real. This was the power couple at North Shore Hospital, Lou Lester and Sylvia Lester.
I needed something that had some importance for helping people. That was what I had wanted to do. When I visited patients up in their rooms, and they would say, that doctor said something to me, and I don't understand what he said. Or a nurse, I don't know who that lady is that's coming in to see me every day. I realized that communication was very important for patients. And if they were on the right side of the track, if they knew what was happening, they were much happier.
You really are the poster child for patient care and patient advocacy. And so I know there's a center that's named for you.
There is now.
Yes.
Not so much the idea of a center, it's the idea that there's a place that people can go to, families, if patients are dissatisfied with the communication aspect or with what's happening to them, and they would like somebody to know that, who could do something about it. When we get to special events and things patients don't even have a part of, but their family can have a part of, it's good for them to know that there are things going on to help them in some way.
Claude Sherman is 89 years old and has dedicated more than 9,000 hours of volunteer work here at North Shore University Hospital since 1993. Claude brings comfort to the concerned family members in the surgical waiting room as they wait to hear news about their loved ones.
I started in the emergency room 21 years ago, and then whenever they needed somebody else elsewhere, my main goal really is the surgical waiting room, where we greet the patients coming in for surgery. We register them, and we explain to the family what's going to happen. And we try to make a difficult day a little easier.
It's a very stressful time when people are in the hospital, and how wonderful that you're there to add that human quality, that human touch.
I always say to them, people don't come here for a manicure or a pedicure.
No, this is true.
This is a very serious thing.
Absolutely.
And we do understand that when they come, they're uptight. They're uptight. It's a crisis in their lifetime. They wonder, oh, the doctor told us it's going to be an hour-and-a-half procedure. It's already 3 hours. We call up the operating room, and we try to find out if everything is still going on. And as long as we tell the people it's still in progress, that's really all they want to know, that the patient is still on the operating room.
Right. Well, it seems to me that North Shore is a family for you, and you help so many of the families that are here, and yet you're part of the North Shore family. I noticed that you have many medals on this ribbon, so maybe you could tell us a little bit about that.
This is just for coming to work, really.
Well, they say, you know, what is it, 90% of success is just showing up?
This is 5 years, 10 years, 15 years, 20 years. This is a lifetime member of the auxiliary. Now, the auxiliary is something a little different also. This is 9,000 hours of volunteering.
Wow. 9,000 hours.
Yes. This is sign language. And this is past president of the auxiliary. I was actually the first male president of the auxiliary after 50 years. The auxiliary is a fundraising arm of the hospital. Actually, we did pledge $2 million to build a cath lab, which has been used. Presently, we are paying off a $2 million pledge for the helipad that's being built on top of the tower building.
That is such an exciting...
Yeah, it's very exciting. It's going to make a really North Shore Hospital like a crisis center. And we repay an average about $500,000 a year, which we raise through functions. Your
mission is to make sure that they know that you're there to care.
Yes, and frankly, I'm looking forward to come, and when I go home, I kiss the ground and I say, well, I did something good. I try to help. And I think this is what life is all about. You just can't take all the time. You have to give back. And giving back to our community, the town of North Hempstead, I think is very, very nice because the town does a lot for us too.
At 97 years old, Arthur Seidman is an inspiration. He has been volunteering at the hospital for 19 years, adding up to 600 hours a year.
I hope it's all right with you if we just talk about how young you are. So I understand you're almost 98.
I got a couple of months to go.
I said almost.
Yes.
And
yes.
So clearly the life of volunteering agrees with you.
It's a commitment, and I'm sure we all feel honored to be honored.
Well, you can see that you do it with love. And, you know, I also understand that your son works here as well.
My son's a doctor in the hospital.
Right.
Yes.
So it really is a family affair?
He's an attending physician. He delivers babies, and a good friend of Sylvia's was the one who's responsible that he is here, Arnold Fenton. I volunteer in the surgical waiting room, as Claude does, and I have to say it's a labor of love. We come there and we log in the family, and we know that's very stressful for them.
Sure.
So we try to give them a sense of ease that their patient is in capable hands, and that the patient will come out better.
That's the goal.
Yeah.
But you know, you can only imagine the tension and the anxiety that families feel.
We've all been in the same situation, and it's. And some people are more stressful than others, and you have to realize that.
Well, you know, you've got such a wonderful manner, and you seem to be just such a very kind person.
We were doing this because we want to do it. And also I have to tell you that I work in the Monta Center. That's where they administer chemotherapy, and it's a very, very special endeavor that a volunteer can do. I think I'm good at talking with people, and I've lived a long life, so I have a lot of stories to tell. I'm a veteran. I was in the Army for 5 years. I established a relationship with these people, and I'm proud to say that when they come there, they ask where I am and would I stop in and say hello to them, which I do, of course, and the time goes very quickly. You're talking to people who really want to have somebody talk to them and put them at ease. A volunteer does this because he wants to do it. And as has been said before, we're giving back to the community. You live in the community, and if you're able to, I think that people, especially older people, should give back. When I get up in the morning, I have a place to go. And this is really my second home. And I come here and full of enthusiasm and hoping that I'll do something good today.
Supervisor Bosworth presented them all with proclamations in recognition of their selfless service.
I'd first like to thank everybody at North Shore who helped to facilitate this so that we could honor these 3 very special volunteers, people who really care
And love.
Claude has, over the years, dedicated these 9,000 hours to bringing comfort to concerned family members in the surgical waiting room. You're chairman of the auxiliary golf outing and first vice president, and also an associate trustee of North Shore LIJ system. So your caring and compassion and that nature extends beyond the visitors to the hospital. I'm also told that whenever a volunteer or a volunteer's family member passes away, that you attend the wake, you pay a shiva call on behalf of the auxiliary. Every Christmas and Mother's Day and Father's Day, you distribute gifts to all the patients. You make North Shore a better place. It's that real touch of humanity, and so I'm so honored to give you, this citation, and it proclaims that Wednesday, the 22nd of October, 2014, be declared a day of special recognition throughout the town of North Hempstead for Claude Sherman. So and Arthur has been volunteering at the hospital for 19 years, adding up to about 600 hours a year.
I have over 12,000 hours.
Wow, over 12,000 hours. That's extraordinary. Knowing that you're sharing, whether it's your war stories, or your hospital stories, or your family stories. I know we're fortunate that we're joined by Arthur's son. You are the chairperson for the annual auxiliary car raffle, and you've also served as the auxiliary chairperson for the Tribute Fund, a program that allows people to honor, their loved ones.
That's right.
You handle the correspondence with the families who've made donations. When do you have the time to do all this?
You have to have time.
You do. And your giving spirit and compassionate and kind nature make you so indispensable to the patients, to their families. You enrich everyone's life that comes in contact with you.
Thank you.
And so it's really an honor to present this proclamation.
Yes.
So we're proclaiming that Wednesday, the 22nd of October, is a day of special recognition throughout the town of North Hempstead for Arthur Seidman, and it's an honor to be here too. So last but we know not least is my good friend Sylvia Lester. So Sylvia began volunteering at the main reception desk. We talked about that, greeting patients and visitors. And then you became the auxiliary chairperson for the reception desk, right? And you served as auxiliary president from 1967 to 69. And you were also involved in so many of the fundraising efforts in this hospital.
The fairs and stuff.
All of that. But I think you were the one who really understood so clearly the importance of communicating with patients, communicating with their families. North Shore is the great place that it is because of the doctors, because of the nurses, because of the staff, because of the auxiliary members, because of the volunteers, because of all the people who care so deeply about this very special place. And you can't help problems from arising. The real measure is how you deal with them. And you made sure that those problems were addressed and that people felt well taken care of.
When we founded the program, 1976, called Patient Relations, that was what Judy was just talking about. But then the hospital carried on after that, and now it's patient and family relations, and we have a wonderful service upstairs, and I'm so proud of them, from the early days until now. So thank you.
And we're so proud of you. Again, that Wednesday, the 22nd of October, be declared a day of special recognition throughout the town of North Hempstead to Sylvia Lester.
Thank you so much. And don't you all forget the special events programs that we started in the auxiliary. Flea markets, every year, golf and so on. That's an important part too. It raises money, it raises spirit, and people are happy to come here and be part of us and be part of whatever we do to make things work.
Hospital officials also took the supervisor on a tour of the emergency department triage area, Katz Women's Hospital, and the Patient Logistics Center.
And this is it's got a great view of the entire landscape of the hospital, spread across 1 million square feet, and we're on 58 acres, our campus is. We're 61 years old, so built over those years, everything's kind of been an attachment on.
And yet you've managed to make it so it seems like one cohesive
Exactly,
hospital, which is extraordinary.
Supervisor Bosworth was amazed after seeing the new Cats Women's Hospital.
Refrigerator.
Where were you when I had my babies?
Safe, exactly.
Delivering mothers have their own private room, private bath, upgraded linens, room service, fresh flowers, champagne toast, accommodations for loved ones to sleep, a refrigerator, and even a dining room.
In 2013, we delivered 6,593 babies. Our sister hospital, LIJ, also has a Cats Women's Hospital, and they deliver about 6,000 babies as well. So between the two of us...
You're populating Long Island.
Yes, we are. We're very, very lucky and so grateful for the Cats family for this ability to provide this experience for every mother. The baby, as soon as possible, would be put next to the mother and have skin-to-skin contact. It's a better way for them to connect, better way to initiate breastfeeding, and the baby can stay in the room the entire time and does not have to leave. So mom has the choice, if she wants the baby to stay here, the baby can stay her entire time, or the baby can go to the nursery, let mom have some sleep, depending on whatever she'd like to do, which is really, really nice.
North Shore University Hospital also has a brand new patient logistics center. It focuses on the data analytics of the hospital, so they can monitor how long it takes patients to go from the emergency department to a room, how long it takes staff to clean a room, as well as direct live news feeds and live notifications from incoming EMS services. They focus on hospital efficiency and also ensuring patients are treated with the highest care and getting discharged safely.
Many people move to our town for a number of reasons, but one of the things that people don't often talk about is that the medical care here is so extraordinary, and being in such close proximity to a university center like North Shore, LIJ, is actually something that's very comforting to people to know that nobody wants to need it, but should you need it, that kind of care is a stone's throw away.